and graduates to the Spring 2012 pinning ceremony. I am very happy that all of you could be with us this special occasion. Each pinning ceremony has its own special meaning for the graduates, their families, and the faculty. We are celebrating both the successful completion of a journey and the beginning of a very new and exciting one for each of these graduates. The 40 pre-licensure graduates will now serve our community and promote the profession of nursing with competence, skill, integrity, and caring. The 16 RN to BSN learners have responded to the Institute of Medicine's call for 80% of the workforce in nursing to be BSN educated by 2020. They are all leaders in the field. All 56 graduates will be ready to start graduate school, many of which will return here to the new Francis Marion University MSN programs that will be starting in January 2013 to become a family nurse practitioner or a nurse educator. As of tonight, as an independent program of nursing study, Francis Marion University has graduated 279 baccalaureate nurses to serve the PD region over the past 6 years. And tonight we are proud to add these 56 more to the number and congratulate them with this traditional pinning ceremony. The tradition of the nursing pin originated with Florence Nightingale in the School of Nursing at St. Thomas Hospital in London. Florence Nightingale was awarded the Red Cross of St. George for her selfless service to the soldiers in the Crimean War. She chose a medal to present to her most outstanding graduates. It has subsequently become a tradition to present all graduates from nursing programs with a pin upon completion of the program. The Francis Marion University Department of Nursing pin signifies our core values: commitment, competence, and caring. We know that the graduates will wear this pin and represent the profession and the department with integrity, honor, and pride. It is my pleasure to introduce our special guests for this occasion, Dr. Fred Carter, President of FMU.
Thank you, distinguished guests, parents, friends, and graduates. On behalf of the university, our trustees, our faculty, our staff, and students, I'm delighted to extend to all of you a warm welcome this evening. Permit me just a personal moment here. I want to introduce two people in the audience who have been extraordinarily supportive of this program over the years. One is Bradley Calcutt, the Executive Director of the Drs. Bruce and Lee Foundation, whose foundation not only gave the preponderance of money necessary to build the Lee Nursing School, but also has continued to contribute very generously to fund nursing scholarships over the past few years. Many of the nursing students here this evening were beneficiaries of that generosity. Would you stand up, Bradley? Let me just emphasize, my friends, that's millions and millions. The other person I want to introduce this evening is Jean Leatherman, whose spouse, Senator Hugh Leatherman, worked diligently to acquire the appropriation to start this program 7 years ago, has worked diligently to acquire appropriations to expand the program over time, and I know even as we sit here is working diligently to acquire an appropriation to begin that nurse practitioner program in January. Jean, would you stand up and let us welcome you? Again, millions and millions. You know, this ceremony, which is held prior to each commencement, is a very, very important occasion on the university calendar. This event recognizes both symbolically and practically the extraordinary accomplishment on the part of these students, all of whom are about to become BSN nurses sitting before us this evening. These 56 women and men graduating from the program this week will join, as Ruth just told you, the 276 graduates that this program has produced over the past 7 years. And we're especially pleased that the vast majority of these graduates will remain in South Carolina, with a substantial portion of them staying and pursuing their careers in the PD region of South Carolina. Frankly, that's why this program was created. And that's why the Drs. Bruce and Lee Foundation, McLeod Health, Carolinas Hospital System, the Marlboro Charitable Trust, and dozens of individual donors contribute hundreds of thousands of dollars each year to sustain the scholarships and operational support necessary to maintain this program. That's also why hundreds of thousands of dollars have been contributed privately to permit us to establish the graduate nurse practitioner and the nurse educated programs that will enroll their first classes this January. As you might imagine, all of us at Francis Marion are very, very proud of these successes. But my friends, make no mistake about this. The successes have come about as a result of two things: the dedication and competence of this extraordinary faculty sitting on the stage this evening, and the commitment and work ethic of the nurses which will be receiving their pins this evening. Those are the two parts of the equation that have come together for a very, very successful end to this educational venture. Both are indispensable to the development of a qualitative program, and their collective might has allowed us to develop one of the finest programs in the state in less than a decade. And if you don't believe me, look at the NCLEX scores. They tell the story. So let me extend my compliments to the faculty, my congratulations to our graduating nurses, and oh yeah, my thanks to everybody in this audience, especially the nurses and this community, for the support you've provided this university, this faculty, and these graduates to get where we are today. Believe me, none of us would be here without your support. Thank you very much.
Thank you, Dr. Carter. I would also like to introduce other distinguished guests that we have here with us tonight. Dr. Richard Chapman, Provost, Dr. Peter King, Associate Provost, and Dr. Jeanette Myers, Assistant Provost. Next, I would like to introduce Dr. Karen Thompson, who will have the honor of telling you about our esteemed speaker. Thank you.
Good evening. When I became chair of this wonderful event that honors you and all your hard work and accomplishments, I inherited the task of selecting keynote speakers. My goal was to have quality speakers that represent role models in nursing and who inspire you to do your best and greatest. I developed a few criteria I felt would need to be met in order to meet this goal. They include scholarly activities, work that has had an impact on the practice of nursing or on patients' lives, and probably somebody from the PD region. Once the criteria was developed, I knew immediately who to contact, since our keynote speaker tonight has achieved each one of these. Dr. Coretta Jennerette received a BSN from Clemson University in 1993 and continued on with her studies. I first met her as a classmate during graduate school at USC Columbia. We were both working on our masters and met while taking nursing research together. Honestly, I couldn't wait for that class to be done. But she found her calling. Dr. Jennerette stayed at USC, and in 2004 she completed her PhD. During her graduate studies, she was a staff nurse at McLeod Regional Medical Center working on the oncology floor, and an instructor for the MUSC Satellite Nursing Program right here at Francis Marion University. It was here that our paths crossed again, and in 2003 when I became full-time faculty for that same nursing program, and she became my mentor. Yes, I know those were memorable moments for Dr. Jennerette, but short-lived. 1 year after we began working together as faculty and she completed her PhD, I arrived on campus to find her talking with our colleague Diane Santiago, who nicely came tonight. There was a serious tone in the room, and Diane informed me that Dr. Jennerette was leaving us. She resigned her position here. I, of course, burst into a, "What? How could you leave us?" There was only 3 full-time faculty at this program at the time. And it consisted of Diane Coretta, myself, and a few adjuncts. So losing her was really going to have an impact on our program. So of course my next question was, well, where are you going? To Charleston? I figured MUSC wanted her to come down there since she now had her PhD. She replied, no, Yale. Yale? Yeah, Yale. This was probably one of the few times in my life I was speechless. Yes, Yale. What does one say at a moment like that, but when do you start? Dr. Jenerick began the next chapter of her life at Yale University and stayed for 4 years teaching and completing a postdoctorate fellowship while there. In 2007, she left Yale. I thought it might have been the winters, but I think she said it was the commute back to come home, and is now an assistant professor at the University of North Carolina in Chapel Hill in their nursing program. Since 2004, she has published over 16 research articles on the subject of sickle cell anemia, received numerous awards and scholarly honors, and has been a speaker at many professional meetings. There is no doubt in my mind that she exemplifies what one can achieve in the profession of nursing, even from a woman who was born and raised in Neesmith, South Carolina. The Department of Nursing at FMU is honored that she accepted my invitation to speak to you tonight. It gives me great pleasure to introduce a woman I have known in many ways and an exceptional example of the nursing profession. Please welcome Dr. Karen Jenerick.
I think Karen has delivered most of my speech, but thank you, Dr. Thompson. So, to the distinguished leadership of Francis Marion University, faculty, staff, guests, and certainly the honorees, the nursing students who will be receiving their pins this evening, I bring you greetings from the University of North Carolina at Chapel Hill. That's how they like us to say it. And my dean, Dean Kristen Swanson. So although I bring you greetings from North Carolina, as Karen said, no, I am a South Carolinian. In fact, if you take the Old River Road going southeast and get very lucky and don't encounter deer, don't get behind a tractor or a slow driver that you can't pass on the curve, because you certainly can't pass them on the curve, then you will actually arrive in my neck of the woods in Georgetown County. I spent a little time in Neesmith, which is in Williamsburg County, but my home is in Georgetown County, so we have to clarify that. So that's about 55 minutes away. So when I say it's good to be home, I know what I'm talking about. Not only is it good to be home, it's good to be invited to come home. A lot of people can't come home and speak on such a prestigious occasion. I remember receiving my nursing pin some 2 decades ago. And yes, that seemed like a long time, but it really goes by very quickly. This area is also special to me because, like Karen said, I had my first nursing job after I graduated from nursing school in Florence. And my first position in academia was at Francis Marion. My daughter and husband are here today. Here's Jameson and Roosevelt. Jameson completed 3K and 4K at Christian Assembly before we moved to Connecticut. And my husband was known as the president during our time at Francis Marion. No disrespect to Dr. Carter. We can talk about why afterwards. So, when Dr. Thompson asked me to be the speaker, I immediately asked her, what do you want me to talk about? She said, just talk about your journey. I think she pretty much covered that. As you can tell by her introduction, I've had quite a journey thus far. What she didn't tell you, and probably didn't really know, was that my journey was not planned. Although it was not planned, I had a lot of help with navigation along the way. I will repeat that. My journey was not planned, but I had a lot of help with navigation along the way. That will be the only thing that I will repeat because Karen, Dr. Thompson, told me that I should limit my talk to 15 minutes, and I know how to stay in my lane and move over when necessary. Understanding your lane is an important skill. That being said, I will speak more about things I learned along the way rather than simply recounting my journey. However, just for a little perspective, note that I was born in what would be considered the excluded group compared to the dominant groups in the U.S. I've achieved a formal education, but I certainly was not born into a family where that was expected. I'm the youngest of 4 children. My mother had a 7th grade education, and my father always told us that he was promoted to the 1st grade, but never attended because he had to work on the farm. This may seem strange, but let me add that my father was 55 when I was born. I always tell people I'm made out of spare parts. I lost my mother to heart failure when I was 14. She was 15 years younger than my father. Perhaps knowing the importance of a mother in the life of a teenage girl, some have little expectation of me doing well or doing anything beyond graduating from high school, if that. Despite these challenges, I graduated from Pleasant Hill High School as valedictorian and went on to Clemson. I'm the first person in my family to receive a bachelor's degree, and I say that the journey was not always obvious and that one should observe and collect some data before superficial perceptions that result in inappropriate conclusions. This certainly applies to healthcare, and it's one of the reasons that nursing students are taught ADPI, you know what that is? The assessment being first and the evaluation coming last. So, speaking of teaching, my first job in academia was here. Perhaps you wonder what kind of instructor I was and what you missed out on. I taught fundamentals, health assessment, med-surg, research, and synthesis. Not all at the same time, of course. Fundamentals was, of course, my absolute favorite. It was very hard work, but it was probably the most rewarding and entertaining at times. I remember well when we were learning about blood pressure measurement and practicing in skills lab. One student placed the blood pressure cuff on her partner and she carefully, meticulously inflated that cuff. As I walked around the room, I noticed her hand was raised. She said innocently, "Miss Coretta, I can't hear anything." You all know what the problem was. She was not using the stethoscope. She was so excited and nervous. So, I brought you back to that example from fundamentals because that is sometimes what nurses lose, the desire, for lack of a better word, to do once they obtain their degree or license. There's a reason why you're taught fundamentals first. And I want to use fundamentals to share 3 important points in the time that I have left, because I know I'm on the clock. So, have all of you worked as nursing assistants? Pretty much. So, in the program at UNC, students are required to work as nursing assistants the summer before their senior year. For those of you who have worked as nursing assistants, have you seen a nurse sitting at the nurse's station answer the call light or her phone, and then she begins to tell the patient that she'll send someone in to help them? She passes it on. She's sitting there or on the phone and not really participating in any professional activity. Facebook is not a professional activity. The nurse tells the patient that she'll send someone in, and she calls the nursing assistant, who probably is already in the middle of taking care of another patient. Have you been that nursing assistant? Remember how it feels when you transition to a nurse. When I was a staff nurse, I returned to work one day and the nurse received report from said that Mr. K, a patient, will be glad to see you. He was telling everyone that I was the best nurse he'd ever had. I remember Mr. K from my previous shift, but could not recall anything specific that I did for him that would have elicited such praise. Come to find out, what I had done for him was assist him to get on the bedpan and give him some privacy. Point number 1, don't be the nurse who spends more time at the nurse's station than in your patient's rooms. Interventions such as hourly rounding, which theoretically nurses were already doing or should have been, have improved outcomes, but fundamental skills provide the case that nurses should be able to do anything that a nursing assistant can do. I know that willing and able are 2 different things. By contributing to providing fundamental care when you can, when it's appropriate, you will also develop great relationships with your patients and coworkers. Most people want to learn and work with team players. What better way to do a skin assessment or to help learn more about your patient than giving a bath or turning a patient? I believe that nursing is an art and a skill, and these things are developed over time. You are not going to graduate being able to multitask and float effortlessly around the nursing unit as if everything is under control. In fact, you should be asking for help and expecting that you get it. That is what the first few weeks or even months of orientation are for. So I'll get off my soapbox and move on to the next example. One of my most memorable students, and Diane may remember this person, who I'm friends with on Facebook now, gives me credit for the nurse he is today, and he is the exemplar I'll use in the next scenario. So, he arrived to clinical on time as usual, and he was going about the business of providing patient care. We spoke briefly, and he was on the way down the hall when I noticed something very strange. I know his uniform was supposed to be all white, yet I'm seeing colors for some reason. My professional nursing student was wearing polka dot underwear. I called him over and I asked a somewhat rhetorical question, "What are you wearing?" To make this long story short, he was surprised that he had to go home and change. So this brings me to my second point. I'm sure you know this, but this is just a reminder. Nursing is a profession. If we want to maintain and grow our profession, we must adhere to professional standards. The rationale for the uniform, and yes, that includes shoes, is taught in fundamentals and/or as a part of professionalism for a reason. So that's all I'm going to say about that. And my last point is about caring. We know caring is fundamental to nursing. I like to broaden the use of the word beyond the care that nurses provide to patients, families, and the community. I want you all to consider the importance of caring for yourself. Nursing is a great profession, but once you have a nursing degree, some might ask you to stretch beyond your capacity, both mentally and physically. You have heard the terms burnout, compassion fatigue. Your employer may ask you to work extra shifts or take on roles that you're not prepared for. Friends and family may ask you health-related advice. A few months ago, now I'm in North Carolina, a few months ago, I received a call from a relative in South Carolina stating her daughter was about 39 weeks pregnant, had not felt the baby move in a while, and wanted to know if I thought she should take her in to be checked. Did I tell you my clinical background is in medical oncology and my program of research is about self-care management and sickle cell? I have no recent L&D experience, and in fact, my daughter's 13. It's important to understand your limits and again, stay in your lane. So, how can you enjoy the art of nursing and continue to care about yourself? I say develop a great support system. You need people in your life that don't mind hearing about the wet nasties. I won't talk about the wet nasties now because I know there's a little reception. The dinner table is, however, a great place for sharing, but you have to know your audience. So, do most of you already know where you're going to work? Whether or not you have an employment commitment, consider whether the environment at least has the potential of being supportive of your professional growth. My first nurse manager was wonderful. He was in school working on his master's in health administration while I was working on my MSN. He supported me in becoming an oncology certified nurse. When I transitioned into academia, I knew that I was a pretty good clinical nurse. I'd been a great preceptor. However, I didn't really have all the skills to be a great educator. I was lucky that my department chair at that time at FMU, Dr. Sylvia Lufkin, supported faculty in becoming certified as nurse educators. So, when you're seeking employment, or even if you've already secured a position, also ask about just culture within your agency. By definition, it's an environment of trust and fairness where it's safe to report and learn from mistakes and system flaws. Everyone makes mistakes. Nurses make mistakes. New nurses make mistakes. My first medication error as a new nurse was giving Meprogan instead of meperidine, which is Demerol, not even on a lot of formulators now. The patient had orders for meperidine and Phenergan, but just not the combination drug, which is Meprogan. The error was before Pyxis, but there were other issues that made it easy for me to make this mistake. I was in a hurry and trying to be Nancy Nurse and not asking for help, but the two drugs were stored beside each other because the narcotics were in alphabetical order. I realized that I gave the wrong drug, obviously afterwards, and thankfully there were no adverse outcomes. Still, I had to write up an incident report and the physician had to sign it. And of course, it was the best physician ever. He scared me to death because I was told he had a reputation of yelling at nurses and throwing things. Then I had to meet with my nurse manager and repeat the 5 rights. There was never any discussion about the system, and the system didn't change until years later when we got the evidence that dispensing the medications via the Pyxis machine was a lot safer. So now we've moved on to barcoding, etc. So consider the culture of the environment that you choose to work in and see if it fits your needs to be supportive of your professional growth. Finally, you have been taught by a group of very educated, experienced nurses. Many of them I had the pleasure of working with in the MUSC satellite program. Care enough about yourself and the profession to continue your education. No, you don't have to enroll in a graduate school right away after graduation, even though it's certainly available to you. Consider opportunities for both formal and informal education throughout your nursing career. So, I'll leave you with the saying that I began with. As a new nursing graduate, you know a lot, but you don't know everything. So at the beginning, you may need to stay in your lane, but over time, you will be the one helping to build new roadways and bridges into the profession of nursing, and that will result in better health outcomes for patients and family. Best of luck, thank you, and again, congratulations.
Thank you, Dr. Generette, for your inspiring words. The next portion of our program is presentation of students' awards for excellence. These awards are decided upon by the course coordinators in collaboration with their clinical faculty. They represent students who excel in each clinical area as patient advocates and student leaders. I will now ask the course coordinators to present the award. The first award will be the Medical Surgical Award, presented by Mrs. Lynn Kennedy.
These awards were established to recognize students who consistently throughout their programs inspired what we wanted to see. And in Med-Surg, we would like to award Agnes Elizabeth Polk.
The second award will be awarded by Mrs. Susan Grubbs for psychiatric nursing.
It is my honor and distinct pleasure to present the Clinical Excellence Award in Mental Health Nursing to Lance Carroll Crouch.
The next award is the Pediatric Nursing Award by Mrs. Vicki Martin.
It is my privilege to present this Pediatric Clinical Excellence Award to Lance Crouch, and that is for his professionalism and compassion towards children.
Mrs. Marty Hucks will present the Community Health Award.
The Excellence in Community Health Award is given to the student who best exhibits the ability to care for not only individuals and families, but also populations within the community setting. This year's recipient may be very surprised to receive the honor because of his classroom antics and debates. Nonetheless, this is a clinical award, and this student has certainly demonstrated leadership, professionalism, and caring in the clinical arena. It is my privilege to present the Semester's Excellence in Community Health Award to Andrew Cahoon.
The Women's Health Nursing Award will be presented by Dr. Karen Thompson.
Never an easy decision, and I know how much you all loved obstetrics, so. And again, I discussed with Ms. Todd who the recipient will be, and this year's recipient of the Women's Health Award will go to Jenny McFadden.
The next two awards will be presented by Mrs. Regina Smeltzer. These are for RN to BSN learners.
first award is the Public Health Project Award, given to the student with the most outstanding public health project. And I solicited the help of the instructor who taught that course, and this is the message that she sent back to me. Regina. There were several high achievers in this class with excellent community-based project proposals, so this choice was hard. We have many people who have already learned to go in the other lane in the RN to BSN program. One stands out because the student caused a change in her community by focusing on a workplace issue, a personal desire, and an identified community need. Her Be Prepared, BEE, Prepared project was based on an outstanding community assessment. Her project involved community-based disaster preparedness education in Florence County through the combined efforts of the Red Cross, DHEC, and the County Emergency Preparedness. She joined the Medical Reserve Corps during this class, which was above and beyond the class requirements. The student is April Howell. The second award is the Leadership Project Award. The Leadership Project Award is given to a student who developed a project that would impact the PD region in a significant way. The students are challenged in their leadership course to work with a nurse manager of their choice and develop a project that nurse manager would do if he or she had time. This too was a difficult decision because we had many students who didn't stay in their lanes well at all. However, when you look at the impact, this student's project would touch many, many lives, not only professional lives, but lives of families and lives of people who were in the stages of death and dying. If you've ever been in a situation to be a caregiver or have to make end-of-life decisions for someone that you love, it's very, very difficult. This student developed a project, a pamphlet, that she was able to give to families. I see the look of surprise. That she's able to give to families that would describe feeding patients and hydrating patients at the end of life. That's a very difficult decision to withhold feeding and withhold fluids. And you can tell them when they're admitted to a hospice unit, but they forget. And so she developed a brochure that they could keep with them. They could hold it, they could refer to it, they could use it as they made those decisions. They could take it home to reinforce that they made the right decision. This award is going to Joy Brown.
The final two awards go to pre-licensure nursing students who have the highest GPAs and have been academically accomplished throughout our program. The student with the highest GPA is Bobby Seegers. Another very high GPA throughout our program has been Adrian Price. I would like to invite Andrew McCone back up to the stage to present the Faculty Award.
We almost lost it to Bobby, but here it is just in case. Now, as a collaborative effort, we voted on this, and we felt that this person in particular exemplified a lot of what Dr. Jennerat was saying, obviously bestowing compassion, somebody who's approachable, somebody who basically bestows dignity in us each and every day, somebody who described a lot of the products and everything that a nurse is supposed to basically produce. And we really appreciate her, we appreciate all of them, but we felt like exemplified this was Dr. Karen Giddings.
We will now move on to the pinning of our graduates. The graduates' names will be called by Dr. Karen Giddings. The RN to BSN graduates will be pinned by their director, Mrs. Regina Smeltzer.
Lauren Elizabeth Allred. Erica Lauren Ayersman. Autumn Nicole Bendel. Portia Bolden. Elizabeth Seif Brown. Lauren Faith Bryan. Brittany Todd Causey. Karen Emily Chinnick. Lance Carroll Crouch. Katie Jean D'Angelo. Jennifer Lee Eaton. Portia Renisha Ellis. Barbara Jean Epps. Rachel Elizabeth Gettings. Eleanor Christian Harrell. George Maxey Harrison III. Tara Kelly Hooks. Courtney Elizabeth Keene. Bridget Nicole Lee. William Andrew Little. Jenny Lee McFadden. Andrew Lyle McComb. Whitley Brianna Mims.
Good job, Whit.
Marion Claire Morris. Samantha Margaret Owens. Agnes Elizabeth Polk. Adrian Nicole Price. Megan Ashley Rhodes. Shamiel Catrice Riley. Lucius Clinton Ross. Robert Carver Seegers, Jr. Pasha Trogdon Simonson. Alexandria Catherine Valentin. Tana Hicks Warren. Tashira Laverne West. Allison Suzette Wheeler. Eric John Wooten. Joy Brown. Charisse Dupree Hennigan. Carrie Elliott Hoshauer. April Howell. Pamela Ann Worthy.
Please give our graduates a round of applause. At this time, we invite all the nurses in the audience to stand and join us in reciting the Nightingale Pledge. I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous and will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession and will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the practice of my calling. With loyalty, I endeavor to aid the physician in his work and devote myself to the welfare of those committed in my care. Thank you all for joining us tonight. And after the ceremony, you are all welcome back to a reception of light refreshments at the Dr. Frank B. Lee Nursing Building. Pamela Worthy will now close with the benediction.
Traditionally, the nursing profession is celebrated in the first week of May in recognition of Florence Nightingale's birthday. As part of that celebration, many areas do a blessing of the hands, and we thought that it would be a good way to end our ceremony this evening with a blessing of the hands for our students. As we begin our careers as bachelor's prepared nurses, let us take a few minutes to ask a special blessing on our hands. Hands that will provide care, offer comfort, and bestow compassion to our patients and their families. No matter what type of nursing we choose, we have accepted a call to bless others with our hands in and through the work that we will do. Let us pray. Lord, we pray that your presence be in all that you would have us do, and grant us the ability to accept that where you place us is where we belong. Renew in us the awareness of your sustaining love that touches us each and every day. Open the eyes of our hearts to see that you touch the world through the hands of many people. As you touch us, may we in turn touch others to give hope, grace, and compassion. And now, Lord, blessed be the hands that will touch life. Blessed be the hands that will comfort pain. Blessed be the hands that will embrace with compassion. Blessed be the hands that will perform treatments and deliver medications. Blessed be the hands that will anoint the sick and offer blessings of hope. Blessed be our hands as you allow us to hold the wonders of the future. Blessed be our hands as they are the work of your hands. We ask this in your name as we seek the leadership of your unseen hand. Amen.